Eric, thank you for that. And yeah, this is an important discussion because it's something that impacts, I think, all of us. Now, 1 in 5 adults here in America experience mental illness, some sort of mental illness each year. May is Mental Health Awareness Month. It was established back in 1949, highlighting the importance of mental health and our wellness. Licensed marriage family therapist Stephanie Rosenfeld is joining us, the founder and clinical director of Clear Mind Counseling in San Diego. Stephanie, it's great to have you.
Thank you for having me.
This is such an important topic because I know for so many of us, people are struggling. They don't realize that they may need help.
Sure.
So let's talk about that initially. How busy is your practice right now? What are you seeing in your office?
We are really busy. Ever since the pandemic, and even before the pandemic, lots of phone calls, people coming in, really not feeling well, general anxiety, depression, burnout, but lots of phone calls.
A lot of phone calls, people trying to get appointments, right?
Yes.
Okay, so how have you handled the kind of increase in these calls and people needing help?
So my practice has grown significantly, so we have lots of clinicians ready to help. I think there have been a lot of practices that had rapid growth during the pandemic, so virtually in person, there are more options now.
Now, I can tell you right now, when I've looked, just personally, going through the list of what's covered by insurance, it's a hard list to get through, calling each office. Some take insurance, some don't.
Sure.
Some are completely booked out, won't accept new patients. And I think for a lot of people, when they need that help, it's like the hardest thing to hear, sorry, we're not available. So what's your advice to people that have been going down that list and can't find anybody?
Absolutely. It is a major struggle. So a simple web search, just where to start, would be therapists in San Diego, therapists near me by zip code. They have directories such as Psychology Today, and then practices should show up wherever you're searching. And there should be something available, and if not, you could always go to your primary care physician, get a referral, and go that way.
Okay, so primary care physicians can also be involved.
Yes.
This is not a separate kind of medical field versus mental health field.
No, it's a great place to start.
Okay, that's good to know. And as far as what people are coming to you for and kind of the advice that you're giving them, can you walk us through a little bit about, I know it's a broad spectrum, I'm sure, but what you're seeing kind of more of with depression maybe?
Sure.
You know, people are just dealing with a lot, the stress of the world. It's just, that seems to be at a different level these days.
Absolutely. So like I said, a lot of people are coming in with anxiety, with general stress management, so life feels very overwhelming and heavy, depression, sadness, problems in relationships. I mean, when we're all this stressed out, we come home, we're not feeling well, we treat our spouse a certain way. And kids and adolescents too are not feeling very well these days.
Right, and we hear all these, you know, surveys and kind of data that comes out that's saying teenagers are going through a lot of, you know, really sad, negative thoughts. Adults are going through it too, and what can we do about it? Obviously, seeking professional help is so important.
Sure.
Let's start with how to know when you need that help. What's kind of that first sign maybe that you need to pick up the phone?
Absolutely. So signs can vary, right? So you could be withdrawn, you could stop doing the things that you usually do, or the things you do just don't feel that great anymore. We could be nervous, we could be avoiding places because we're so nervous. But really that isolation and being withdrawn is a big cue that, hey, we're not feeling very well.
Yeah, there's things you used to like to do that you may not like to do now.
Yes.
Okay, that's one of the red flags.
Absolutely, and just the scope of what we can do gets smaller, right? And just mood shifts, crying a lot, feeling panicky. Those are definitely signs that you need to pay attention to.
And since we have you here, I'm not asking for a full therapy session.
Yes.
But as far as what advice you give to people, are there some clear things that we can do, you know, now if we're starting to feel that sadness? How can we almost, I don't know if it's snap out of it, but what the right term would be, but how do we help ourselves feel better?
Sure, start addressing issues. I always recommend first chatting with friends and family. I mean, we're so lonely these days. So picking up the phone, sending an email, sending a text, just saying, hey, what's going on? And connecting to someone, that would be step one. General self-care, getting out, breathing fresh air, walking around, eating, drinking. I mean, basic stuff, but it goes a long way with
The
our
healthy
mood.
options.
Yes.
Okay. Yeah, of course. That's important. Self-care, I think people may put aside because they're so busy.
Yes.
Tell me how to make sure we prioritize that.
Well, let me see. You have to make time for it like you would anything else. So you invest in your career, you invest in your family, you would have to learn to invest in yourself. And this doesn't have to be a huge undertaking. This could be 20 minutes a day. This could be sliced into 5 minutes throughout the day. But a little goes a long way.
Okay. And I know right now for people that may need any assistance, we do have this number, a very important one. 988 is the Suicide and Crisis Lifeline. You can call or text that. And then, of course, the national helpline, 1-800-662-HELP. So don't hesitate. Obviously, as Stephanie mentioned, if people are feeling these negative feelings, it's important to get that help. Professionals like you are out there wanting to give people that assistance.
Yes.
And how can people find you, Stephanie?
So you can go on our website at www.clearmindcounselingsd.com.
And are you taking new patients?
We
by chance?
are in
Okay.
person and virtual.
In person and virtual. That's
Yes.
important. Thank you very much for your time. I know
Thank
you're
you.
busy, so we appreciate you taking the time
Thank
to come
you
in.
so much.